At CDC, we use a range of quantitative and qualitative techniques in our assessments, which help support public health response and strengthen national security. These include qualitative risk assessments. Different types of qualitative assessments and modeling outputs are useful at different horizons. This section will discuss risk assessments, a type of qualitative assessment that can be done early in an outbreak, even with limited data. These assessments can be updated when more data or analysis becomes available. A qualitative risk assessment is a rapid assessment of potential public health implications of an outbreak. The assessments often consider risk to the general U.S. population and can also address specific populations at higher risk. They are useful for risk communication and response decision-making, and when quantitative data may be limited, like early in an outbreak. Standardized but flexible methods are used to develop risk assessments, with inputs ranging from existing literature, the perspectives of subject matter experts, and historical data. As an outbreak progresses, more data and analytics, including modeling, can be integrated. These methods can be applied to outbreaks caused by a wide range of pathogens, facilitating risk prioritization and standardized communication across diseases. For each population examined, we estimate risk by assessing the likelihood and impact of infection at a population level. We use a matrix like the one pictured here, where risk ranges from extremely low to very high. The risk is higher for a given population as the likelihood and/or impact increases. The likelihood of infection refers to the probability or extent of exposure and/or infection across the population of interest. It might consider the number of people infected, the infectivity of a pathogen, current population-level immunity, and outbreak response capacity to limit spread. Impact refers to the collective impact of both individual infections and population-level consequences. Impact considers disease severity, population immunity against severe disease, and current resources available to limit societal impact of infection. Finally, we also assign a confidence level for each assessment, indicating how much uncertainty we have in the assessment. The confidence assessment considers the quality of evidence, availability, and gaps in evidence, and how well lines of evidence corroborate each other. We will continue with some examples of risk assessments in the next video.